Good morning and welcome to Kirklees Corporate Parenting Board. It's a virtual meeting online on Tuesday the 5th of October. Just to remind everyone present that this meeting is webcast and recorded. If we start with the first agenda item, membership of the board, any apologies, Jodie, that were received?
Apologies received from Councillor Reynolds and Councillor Patterson. Thank you.
Thank you very much. Nobody's aware of any other apologies. Fine, thank you. Minutes of the previous meeting. Can I ask board members if you're aware of any corrections that we need to do to the minutes? I'm not seeing any responses on that, and I'm not aware of anything that needs correcting. Therefore, I'm asking members of the board, are we happy to accept the minutes of the previous meeting, which was the 29th of June 2021? Yeah. Yeah, fine, thank you. Interest, if any board members have any disclosable pecuniary interests, you do need to declare them. Please complete the form in your packs and make sure that Jodie is aware of that. Admission to the public, there are no items that aren't in the public arena today. Deputations and petitions. Jodie, have we any deputations or petitions?
None received, thank you, Chair.
Thank you. Public question time. Have we any questions from members of the public?
No questions received, thank you, Chair.
Okay. There is no reason to exclude any members of the public, so we'll move swiftly on then to item 8, which is One Adoption West Yorkshire Annual Report, and the board will be considering this report, and we have with us Suzanne Whiteley and Michelle Rawlins from One Adoption West Yorkshire, who are going to take us through this report. Over to you. Thank you.
Thank you very much, Chair. My name is Suzanne Whiteley. I'm one of the service delivery managers at One Adoption West Yorkshire, and I'm just going to go through the One Adoption West Yorkshire annual report for 2020 to 2021. Giving you an overview in terms of the work that's been undertaken by One Adoption West Yorkshire, but also just a brief update in terms of the national picture with regards to adoption as well. So in terms of the national picture, the latest figures that have been released show that there is no longer a gap between children waiting and the number of adopters available. However, there is a mismatch between the needs of the children requiring adopters and the adopters who are willing to consider these priority children. The government has provided £1 million to the adoption sector to improve recruitment and preparation of adopters, and with a particular focus on attracting more adopters from the Black and minority ethnic communities. And the national campaign You Can Adopt was launched in September 2020, which focused on myth busting around adoption, which was then followed up by a pilot project for Black adopters in Birmingham and London. In April, a further national campaign around adopted brothers and sisters was launched, with a more targeted approach to seeking adopters specifically for those priority children. The future of the Adoption Support Fund does remain uncertain at present, although a cross-party or parliamentary group has supported the continuation of the Adoption Support Fund, and there is a commitment to continue it until July 2022. There will be a review which is currently being undertaken with regards to the Adoption Support Fund, which will inform future plans for the fund. So as for many organisations, there has been it's been an unprecedented year for One Adoption West Yorkshire. The service has adapted well to the different ways of working during the pandemic, and we have found supportive, creative and supportive ways of working with children and families to make sure that plans are progressed as much as possible. We have maintained our duty and advice service over the last year with staff working from home, and we've continued as much as we possibly can to provide the same level of duty support to families as we did pre-COVID. We've continued to work with operational leads across the 5 West Yorkshire local authorities, and the group has worked together to address interface issues. We've particularly focused on the impact of the pandemic, really focusing on care planning for children and how we move children on to adoption. And we've also had discussions around alignment of adoption and special guardianship payments, and joint audit work has also been discussed across the region. The multidisciplinary team had its inaugural year during the COVID-19 pandemic, which did mean a delay in start of the full operational service. Leeds Community Health were awarded the contract to provide the health element of the service early in December 2020, and the recruitment of healthcare staff then quickly commenced, and all positions were successfully recruited to early in 2021. We've continued to work with the medical advisors and GPs across the region, and the medical advisors have continued to work very hard during the pandemic and providing information for children in respect of their health and medical issues. So the medical advisors have continued to support adoption panels across the region. We have had increased demand with regards to the number of adoption panels, and we have increased them from 7 to 8 per month, and commissioning discussions are underway within the region for medical advisors to support that. There has been some impact in terms of GPs undertaking medical assessments of adopters during the year, which has had an impact because of the stress and the pressures within the NHS. We've worked across the region with the virtual school heads. There's been very positive work undertaken. We run a helpline which can be accessed by adoptive parents, schools and other professionals to offer support and advice where this is needed. And this has allowed us to really understand some of the difficulties that have been faced by families and professionals, which has helped inform our training needs across the region, and really think about what support and what training we need to provide. We've continued to work with schools across the region and have developed an attachment and trauma workshops for schools across West Yorkshire. Grandparents Plus has continued to attend the virtual school heads group for opportunities to share information and knowledge across the region, to be able to support special guardians around education issues, and also growth of referrals to kinship has helped give and provided information for schools in raising awareness around special guardianship arrangements. In particular, with regards to special guardianships, there have been 2 key areas of development over the last year. We've worked together with the 5 local authorities to implement a regional support plan and a regional approach with regards to financial support for special guardians. The kinship, formerly the Grandparents Plus project, has been progressing well, and it's been further supported by the Adoption Support Fund COVID-19 funds. There are 3 project workers offering one-to-one support to kinship carers across the region, alongside support groups and access to telephone advice as well. And there has also been a therapeutic parenting programme designed for special guardianships called Guiding Guardians, which has been commissioned. With regards to the performance management with children with a plan ratified for adoption during 2021, there have been 207 children had a plan for adoption ratified by the 5 West Yorkshire authorities. In total, there has been a slight reduction from the previous year's figures, and that has been reflective of the delays within the court arena. Of the 207 children placed with a plan for adoption, 81% of the children were from white British backgrounds, and 19% of children were from Black, Asian and minority ethnic backgrounds, including children from European, Gypsy Roma, Black African and Black Caribbean backgrounds. As a general rule, we do try and place siblings together. We work together with the local authority to identify individual needs of children and with a plan to place them together. However, this is not always possible to be achieved. We had 91 individual siblings placed during the year. 35 of those children were placed apart, and 32 of those children, the plan was for them to be placed apart. We've had 118 adoptive households approved during the year, which has been an increase against the previous 3 years. We've had 10% of adopters approved who are from Black, Asian and minority ethnic backgrounds. This is an area that we are working towards increasing our number of adoptive families from a range of backgrounds to make sure that families are able to meet the range of children requiring placement, whilst at the same time not relying on matching children with regards to ethnic identity as an overriding factor. We had a number of households approved for sibling groups, which is increased by 8 this year, with 24 households approved. and all 24 households were approved for 2 children, and 28 households were open for early permanence placements. This has slightly reduced, but it continues to exceed the demands for placements for early permanence. At the end of March 2021, there were 137 children with a plan for adoption and have a placement order, but not yet placed. At the end of March 2021, there were 51 adoptive households who were approved and not matched. 34 were in the process of identifying potential matches with children and were in discussions about placements, and 17 of the families were booked into panel. Between April 2020 and March 2021, 183 children from the West Yorkshire region were matched with families at adoption panels. This has been an increase from the previous 3 years across the region and has been really positive given the pandemic. 184 children were placed this year. The percentage of placements provided in-house within the region has increased significantly this year. The percentage of in-house placements was 66% and 34% were interagency. In terms of the adoption scorecards across the region, the A1 indicator was 534 days, which is above the national indicator. 39 of the 157 children were adopted, entered care more than 3 years ago, and 94 of the children were children who wait longer for adoption. Some of the children who were older and have more complex needs, which has resulted in adoption taking longer to achieve, but there has been positives in these children have been adopted and otherwise would have remained within care. With regards to the A2 indicator, the national indicator has increased to, the West Yorkshire indicator has increased to 259 days, which is above the national indicator of 121 days. This does reflect the issues in terms of the national decline, in terms of the number of adopters available and the complexity of children waiting for adoption. In terms of recruitment and assessment over the previous year, the first half of the year did see an increase in the number of inquiries to adopt, which did mean that we did have a number of families waiting to be assessed, and this did present a number of issues for the recruitment and assessment teams across the region. We have recruited to additional recruitment and assessment workers to be able to assess families and increase the number of sessional workers employed by One Adoption West Yorkshire to be able to meet this capacity. We have reviewed our stage 1 processes, and we have implemented a new team so that there are 2 managers overseeing all adoption advisors and families in stage 1 of the adoption process. And we hope that this restructure will provide a greater consistency of experience in terms of the prospective adopters and the decision making in the early stages of the adoption process for families. We are taking steps to increase the number of adopter inquiries again through marketing strategies for priority children in particular, and thinking about how we increase the number of attendees to online information events which take place twice a month. Adoption panels have been running virtually and they have been operating well, although capacity does continue to be a challenge, and we do meet within the organisation to review agendas to make sure that items can be progressed. We have moved to 8 panels per month to increase capacity and hold 2 panels per month specifically to address approvals of adopters, and this allows us to add additional cases. There have been a number of complexities during the pandemic with regards to transitions for children for adoption. So we have undertaken individual risk assessments, both in relation to children and adoptive families, to make sure that transitions can take place as safely as possible and minimise risks for children, adoptive families and foster carers. We have utilised the University of East Angula's move into adoption model so that we can support transitions, and it has really helped in terms of the getting to know you phases of instructions which have been undertaken virtually. Within One Adoption West Yorkshire, we commissioned the Voluntary Adoption Alliance within the region to provide a number of adoptive families for us on an annual basis, so with a minimum of 30 families. This contract commenced at the beginning of May 2020, and during the year we placed 34 children through the Voluntary Adoption Alliance. Profiling events have been held virtually through the year. We've had 5 virtual events take place. We initially engaged adopters approved by One Adoption West Yorkshire, and subsequent events have included Voluntary Adoption Alliance and regional adoption agencies and local authority adopters from across the region. We're also utilising Linkmaker to profile children to One Adoption West Yorkshire families, and also to be able to widen the reach of profiles through to the voluntary adoption agencies as well. In respect of adoption support, the teams within adoption supports have continued to work with families, initially primarily by virtual means and undertaking risk-assessed home visits where there were concerns and more face-to-face support was required. We've seen an increase in number of duty calls, particularly to the duty and advice line, since schools reopened last September, and there were particular themes around difficulties children were experiencing with the transitions from school to homeschooling and then back to school again. We've been able to support parents to seek ongoing placements in school for those children who needed consistency and the predictability of going to school throughout lockdown. Applications to the Adoption Support Fund have continued, while some of the therapies did have to be held for a period of time because virtual means weren't suitable. Many of the therapy sessions have continued, and where necessary, keep in touch arrangements were arranged with providers across the region. We've worked together with Adoption UK to provide peer mentoring. We've got 24 active peer mentors who are supporting 57 families across the region. So they're supporting them via one-to-one support. And there are also 6 families who are accessing enhanced peer mentoring support packages as well. Adoption UK have also worked together with us with regards to preparation training, sibling webinars, experienced adopter training, and webinars for experienced adopters as well. In terms of the work that PAC UK undertake with adults, so this could be adopted adults, birth parents. There have been 472 calls to their advice line, and they have worked with 184 service users across the region. In terms of work with adopted teens across the region, we've had 71 young people engaged with a service provided by PAC UK called Adopteens, and we've had 6 members of the Adopteens Youth Council from the West Yorkshire region. We've experienced 2 disruptions of adoptive placements during the year. This did relate to one placement. Disruption review was commissioned at that point by an independent disruption review so that they could provide us with analysis from an independent perspective. I think it's positive, given that we've experienced a range of lockdowns and different restrictions over the last year, that we have maintained a low number of disruptions. We've had a number of quality assurance provisions in place across the region so that we're able to listen to the views of children and families, build on our performance data, think about practice, wisdom and knowledge, and also use the findings of external and internal inspections, audits and evaluations of practice. In terms of training within the organisation, we've not been able to provide any commission training during the year. However, we have provided home assessment training for members of the organisation, which is being supported by the multidisciplinary team to specifically undertake home inventory assessments with families. We've also provided training to schools. There have been 15 sessions of trauma and attachment training delivered across the West Yorkshire region, and our educational specialist has created and developed online videos to help support families during the lockdown periods and with homeschooling as well. And we've also delivered fetal alcohol syndrome and brain-based parenting webinars, and we've delivered to over 500 staff and adopters and special guardianships as well.
Thank you. Has Michelle anything that she needs to add to that?
No, I've got nothing to add, thank you.
Okay. Any questions from the board members or comments? Colleen, our fostering network rep.
Hi, yeah, Kirklees Fostering Network and a foster carer as well. Just wondering where the hold-ups are with adoption from stage 1 to stage 2 to whether it's the courts or whatever. Some families have said it's taken rather a long time, up to 12 months to get a child that they put ask for. They were approached. So I say it takes quite a long time. So I just wonder whether there's whether you learn from experiences if people put complaints in, and what can we do to make it quicker so these children get to the loving homes that that they deserve, basically.
Okay, I'll pick that one up, Suzanne, if that's okay with you. So obviously our aim is to move people through the assessment process as quick as possible so that we can place children with permanent families at the earliest opportunity. We have experienced delays in assessment of prospective adopters during the pandemic. We had some real challenges early on in terms of GP medical appointments, which is a requirement of the assessment process. And we found that because of the pressures GPs were under, they weren't able to prioritise adult medicals of prospective adopters, and that did slow the process down. We were fortunate that we were able to use the regulations, the regulation flexibility that the government allowed to be able to progress some people's applications without that medical information. But for some people, because of health issues we were aware of, we really did need that medical information before we could progress their assessment, and that did cause delay. As Suzanne said, we also had some issues around capacity. Obviously, our staff were finding COVID a challenge, and we did have some periods of sickness with staff, but also we had an increased volume of inquiries to manage and respond to. So we did increase our number of sessional workers, and we did recruit to an additional 3 social worker posts, and we don't currently have anybody waiting between stage 1 and stage 2 for allocation of a social worker to commence their assessment, which we feel is really positive, so that hopefully there aren't those delays moving forward. I think there can be a number of factors that contribute to delays, and sometimes it's about individual people's circumstances, and sometimes it's about the circumstances of the individual children as well, and what might be happening within the court arena. And we're hoping now that delays that were happening in the courts during COVID have resolved themselves, and things are moving forward much more quickly. I don't know if that answers all your questions, Colleen, or whether there's anything else you want me to expand on.
Couple of families that I would like to put the name forward, but obviously I won't put the name forward in here. If we can look into that and just find out where the delays are and where we can learn from that, so that things get moved quickly, where there doesn't seem to be very many issues. It might be just the fact people can't get to meetings, and I think that's a real shame if that's it, if that's the only thing that's holding a little person, for their forever family. I just think it just needs looking at and see where we can improve that, because we all want kids in special homes for Christmas, don't we? And even, all the time, really, as quickly as possible.
Absolutely. If there are specific cases that you want to raise with us, then absolutely send us the details and we will look into that.
Yeah, I will. Thank you.
Thank you. Councillor John Lawson.
Thank you. I want to take us back to 3.4.29 on page, I believe it's on page 12 of your report. It talks about disruptions, and we're down to 2 disruptions there, which is great news, and it cites hard work and good practice, which is brilliant. It'd just be nice to have a bit of context around that figure, whether that's a return to normal, whether 7 was quite a high number, whether that 2 figure was what that was as a proportion of placements, and through that hard work and good practice, what have we learned and what have we changed? Is there some particular stuff that we can go, actually we've learned something here and we can really take that forward? I'd also kind of be interested in an opinion on whether in a way COVID might have helped with some of the initial bedding in periods, where families need to spend a lot of time really quite close knit together to just make those bonds and attachments. I don't know, could we have some comments around that, please?
Yep, I'll try and take those sequentially. In terms of the disruption rates, we have reviewed our disruptions since the commencement of One Adoption West Yorkshire. It was up until roughly the end of September 2020. And as you rightly say, there was an increase the previous year in terms of the number of disruptions. There had been at a steady rate and were reflective of this, the financial year that we're talking about, disruption rates. So we did see a particular increase during that year. Our disruption rates within West Yorkshire have fluctuated between 0.7% and just over 2%. Nationally, in terms of the figures that come out from research, there isn't necessarily a current picture in terms of that, but research indicates that they are anywhere between 3.8% and 11% in terms of adoption placements. So we're well under in terms of the rate of disruptions. However, none of us want to see an adoptive placement disrupt for a child. It's very serious impact for that child, for those around that child, for the adoptive families, and for us as professionals working with those families as well. We do seek to have an independent review of any disruptions that we have to make sure that there is an independent assessment of what's happened and that they are able to reflect the learning back to ourselves, individual local authorities, and where it's appropriate, any other agency that we have placed a child with, to make sure that we're able to incorporate that learning. We have undertaken from the adoption disruption, there's been multiple factors. It's one of the reasons that we move towards and work towards promoting the use of the University of East Anglia approach to transitions, that importance of that getting to know you stage, the importance of relationships between foster carers and adopters, and slowly building on that for children to feel comfortable and confident in terms of that transition and that move to their adoptive family. Training for adoptive families is also really important in terms of understanding the realities of family life and being able to access support. We've made sure that we've got a comprehensive core offer in terms of our adoption support, and really built on the multidisciplinary team as well, so that we can make sure that we've got specialist access to support provision where it's needed for families, and particularly thinking about families where there is the potential or more risk of a placement disrupting. In terms of COVID, I think it's almost been a blessing and a curse for some families. It's been positive in terms of the transitions, in terms of keeping a child's world quite small, which has been really positive for a lot of our children in terms of not necessarily having to do that transition into a new school and kind of sooner than that's almost been delayed because of the pandemic and being at home. So it has allowed families alongside foster carers to really cement relationships and build time for the children to be able to begin building their attachments with their new families. So it has been a real positive for some families. I think across the board in terms of adoption, I think for some other families where families have got older young people, there has been more challenges in terms of COVID for them. But I think for the front end, it has been positive in some respects. There has been some issues in terms of making sure that support networks have been in place for adoptive families. Quite often they have close family members, friends that they rely on for support in terms of the early stages, and as I think we've all experienced, our worlds have become did become very small. So making sure that we've increased our contact with families and making sure that their own support networks have been in place has been really, really important. And then to support families where it's been able to do so in terms of making sure that we undertake risk assessments to do the face-to-face support as well where it's been needed. I hope that answers the question. I don't know whether I've missed anything.
No, thanks very much.
Thank you.
Thank you, Suzanne. Anyone else with a question or a comment? I'll just make the comment. I mean, I really welcome the multidisciplinary team. You know, it provides so much more resources to families, and I think that's incredibly important. And I am impressed with the sort of therapeutic programme for special guardianship, you know, kinship carers tend to be a little bit forgotten at times, and I think that's really of extreme value. And I think the report demonstrates actually how creative you've been around issues within COVID. I mean, particularly the training, and I assume some of it in the way it's delivered can be a continuing thing if its format is really welcome for recipients, whether it's schools or, you know, parents and so on. So I really welcome that. You did mention early on the problem about GPs not being able to carry out some medicals, and of course we knew that court hearings paused. Have you got a feel that those things are now caught up or on the verge of being caught up? Because that is an issue, isn't it, for making sure adoptions go through as soon as they can do.
Yes, absolutely. I think we've seen a period of catching up from the courts, particularly with regards to adoption orders being made. And we have seen an increase in terms of the number of adoption orders being made. I think we did reflectively see across the region last year a bit of a dip in terms of the number of adoption orders, and that was directly impacted by the court's ability to be able to make those orders. But they have made considerable leaps forward in terms of making adoption orders and trying to progress them through as quickly as possible now.
And do you feel that all the medicals that you expect to have been done are now done, and it's work in progress as normal now?
In terms of the GPs carrying out the adult medicals, we've definitely seen an improvement in that respect, and the vast majority of those are now going ahead within the timescales we would have seen pre-COVID. It's only the occasional practice that might be having difficulties with capacity where that is an issue. Okay,
thank you very much for that. I'm not seeing anybody else indicating a question or a comment, so the board are asked to acknowledge and welcome this, accept this report from One Adoption West Yorkshire. And I assume board members are happy with that. Can I just say grateful thanks to both Suzanne Whiteley and Michelle Rawling for taking the time to come along today and take us through this information. Thank you very much.
Yeah, thank you, Councillor Kendrick.
Thank you. Thank you. Right, if we could move on then, please, to the Children's Performance Highlight Report, please. This is a report giving key highlights from the latest performance data, monitoring data for children's services. Ophelia, are you starting this off?
I am, yes. Thank you, Councillor Kendrick. So good morning. I'm Ophelia Riggs, Head of Corporate Parenting, with responsibility for looked after children and care leavers. Just in terms of the highlight report, what I'm going to do is just, there's some key focus areas that I'd like to focus on. And one is around the number of children looked after. As you can see from the data, we're seeing a continual decline in the number of our children looked after in comparison to our statistical neighbours. So on that basis, I've undertaken a specific piece of work just to identify and highlight what the difference has been in terms of the numbers. So what I've identified is that we have a number of children who have been subject now to a special guardianship order, and so that is the number is 444. And a special guardianship order is an alternative legal order which gives parental responsibility to connected family and friends. So that's where our children are placed. And also we have 86 children who are subject to a child arrangements order. And that order allows children, so it determines where they need to live and also who they have contact with. So from my perspective, and just on behalf of the local authority, that's been a successful outcome for our children and young people, because we currently have 648, as you can see from the data. If we then added and equated the children who are subject to a special guardianship order and a child arrangement order, we would have 1,000 plus children looked after by the local authority, and we will be comparing them with our statistical neighbours. So just in terms of our children who are subject to a special guardianship order, we, the local authority, maintain financial support. So we continue to support the families financially. We also have needs-led assessment, so we look at what support needs they need, and that's available for children up to the age of 18. We also consider and look at where we've got children who are up to 25 who want to go to university or go on to higher education. We've got a financial policy in terms of our care leavers that we will support them with that. So families are not disadvantaged by that, but it allows children to be staying with and connected with their families and not deemed to be then looked after, because there is a stigma around children being looked after. But I think we've got a good news story in relation to that. And again, and that's based on the key principles as well, going back to the Children Act, where possible, children should remain with their birth families. If it's not possible to do so, then we have to look at connected carers and families. And again, that's something that we've done and will continue to do for our children of Kirklees. And again, I think it's just important to say where children need to be looked after, we continue to ensure that we've got that oversight around our children in terms of safeguarding. That continues. We have a process by which we have a legal gateway panel. So the legal gateway panel, that's chaired by a head of service. And what that panel does, the principles of that panel is around endorsing care proceedings. And then any ongoing proceedings, they are overseen by what we have is a permanence panel that also is chaired by a head of service. And we've got that oversight. So we continue to look at the early planning for our children and young people, and then we endorse the final care plan. So we still have that level of scrutiny in relation to our children and young people. So by the work that we're doing, the ongoing support, I think we, again, as I've said, that we successfully have secured children staying within their family networks and staying within their local communities. And just in terms of looking at management oversight, just in terms of our service director, which is really important, that we have ongoing case reviews and dip sampling of all cases that attend legal gateway and permanence panel. So we've got that level of scrutiny, level of external challenge. In relation to ensuring that we're continuing to make timely decisions and planning for our children and young people. So that's one aspect of the report. So I'd like to take any questions.
Any questions, comments? Councillor Andrew Marchington.
Thank you, Viv, that's appreciated. Yeah, just to say thank you again, Philly, for the piece of work on the special guardianship orders and the comparison to statistical neighbours, because that's one of the questions that's been coming up at scrutiny about those lower numbers in relation to other authorities. I just think, again, it'd be good to have a look at actually the amount of work that other authorities do on special guardianship orders to get a fuller comparison around that. You know, you'd think that having a special guardianship order placing children with closely connected neighbours would be a really good thing, and actually if it's working well in Kirklees, which is one of our reasons our numbers have looked after are low, it might be something we want to share with our statistical neighbours and partners as well. Thank you.
Okay, yeah, I'll take that forward. So I will have a look at our statistical neighbours just to identify what work they're doing, but also is there anything that we can do to support our neighbours as well.
Yeah, it's a really interesting thing. I mean, I go to the Yorkshire and Humber Lead Member Network, and only 1 or 2 of those are counted as statistical neighbours, but the picture there is much higher numbers of children looked after, and they're surprised at our results, if you like. And I do wonder if they really are focusing on SGOs and connected carers, and it'd be interesting to look at that. Thank you. Barry Lockwood, who's a Kirklees Fostering Network member.
Yes, I'm just asking about the staying put, because obviously you said over up to 25 university, there will be under staying put. Now, I understand that the policy now is with you. When will that be out?
That's
Barry, can I just, sorry, Barry, can I ask, do you mean the staying put policy or the care leavers policy? There's 2 policies.
No, so the staying put policy.
The staying put policy has been agreed and it is being implemented as we speak. And actually it's on the agenda. It's the next item on the agenda, which I'll be talking to.
Right, that's fine. As long as I know, and then Colleen can sort of like back that up at the next meeting.
Fine.
Okay.
Thank you.
Anyone else a comment or on that part of the performance highlights? No. Can we move further through the performance report, which has all sorts of different pieces to it? Who's going to take the next bit of that?
Hi, good morning. Janet Tolley, virtual school head teacher. I'm going to take you through the education outcomes from page 30 of your documentation. Just to remind you that throughout the last 12 months, there has been substantial disruption in terms of the education of some of our young people because of COVID. We have looked in detail at the COVID support when there was the vulnerable offer and schools were closed. And obviously we have continued then to focus on supporting our young people to go back to school, to re-engage with their education face-to-face. And there's some detail of that in the report. In terms of PEPs, during COVID, we moved to completely virtual PEPs. So that's personal education planning meetings. And that enabled us to be involved in every meeting for every young person. Obviously, we weren't travelling in the same way, and we've continued to do that. So at the moment, PEP completion is 100% high quality, where you've got the virtual school and social workers and schools working together to have conversations and wrap around support around young people. And obviously, we've been focusing during those meetings on the emotional and health and well-being of our young people, how they've been impacted by COVID, what support can be put in place to ensure that they are emotionally as well as physically able to engage with their learning, and also to look at any individual catch-up support that might be needed. Some of you might have heard of pupil premium funding, which we always use to support individual young people, but there's also going to be some additional COVID catch-up. So in every conversation around the education of our young people, we're considering both the emotional impact and then also anything additional that might be able to be implemented to support that young person at an individual level. We're also involved in all initial PEPs. So that's when a young person comes into care. We try to have a meeting with all professionals around their education within 10 working days. And we're very good at that. You'll see there over the year, 97% of PEPs, initial PEPs took place within that timescale. It's really important because often professionals at school know that young person best at that moment in time. And it's about wrapping around care and stability in that situation for those young people at a time where obviously they're really seriously impacted and need as much support as we can put into place. The next indicator was around attendance and persistent absentees. I've talked to you about the impact of COVID on school attendance. It won't come as any surprise to you. I think what I need to say is the figures here are not comparable with anything that's gone previously. So we might have had young people who were ill or who were isolating, who were at home because of bubble closures. So there isn't any comparative data for the stats there. I think the fact that in July we were looking at 45% of young people had some attendance concerns over the year, at initial view would be alarming. But I don't want you to be alarmed by that. I think that was reflective of the national situation. And also, of course, in our area in Kirklees, we were affected by COVID over a long period of time. To reassure you that we have looked in detail at those young people, and where there were what would be called unauthorised absences, we're looking at those young people and supporting them back into school. Well, what are we in now? I think we're in about week 4 of term. So we're making sure that those young people are re-engaging. For many of the other young people who may have had a reported absence of 90% or less, we're clear where that was issues around affected by COVID. And I've put the detail in the report talking about complicated things like X codes and C codes. So an example might be when young people were able to access the vulnerable offer, in some schools there was a full-time virtual offer at home. And some of our young people who engaged 100% high-performing young people with the learning at home, maybe because parents were shielding, they're actually counted as an absence in terms of DFE statistics. So just to reassure you, we have a handle on that. We're mindful that we need to be aware of any young people who emotionally are finding it difficult to go back to school or who had disengaged during that period and are supporting them at an individual level. I think also to say that we have a strong focus on any young people who might not be in full-time education. And just to report for you today that we just have one person currently who isn't on a school roll. That's a young person who's actually new into care as an unaccompanied asylum seeker. So we're actually working at the moment with the social worker and professionals and the young person there. And we do have 8 young people who are on some kind of a part-time timetable at the moment. Sometimes that's about re-engagement and resettling with education. Sometimes that's about a transition into a new school. And we do, as you're aware, focus on any school moves. We work really closely with our social workers and carers to minimise those. But where, for example, there's a move to permanence and a young person in that move to permanence needs a change of school, we work really closely to minimise any disruption and to ensure that transition goes as smoothly as possible. Okay, any questions?
Any questions or comments, board members? I think it was just very clear, Janet, and very reassuring. Thank you. The information is really good. Thank you.
And just to say that the detailed head teacher report that has all the information for the last academic year will be presented to the full governing body, and then that will come back to the corporate parenting board in the near future. So things like the GCSE teacher assessments will come to you in detail then.
Lovely. Thank you very much, Janet. Thank you. I think we're on to children who are looked after and their health, and I think we have Jill Addy, who is the nurse for children who are looked after. Jill,
good morning. Good morning. Yes, so I was asked to comment on the figures that you were provided with. Unfortunately, Locala's figures don't come out until after the report that you needed. So I said that I would bring them here. So you've got the figures in front of you for the different aspects of health that you particularly look at. If we just start with the initial health assessments, these are done for children within 20 working days of them coming into care. The 12-month rolling data shows that 88.8% of them were done in timescales. I like to look at the Locala data because it does give us a month by month, and I think that's really important in the last year and a half that we've had, just to see what progress has been made. But I can assure you that in August, 100% of them were done within the 20-day timescales, and for 9 out of the last 12 months, that has been the case as well. A lot of those were done virtually, that is over the telephone, to make sure that we get birth parents, social worker, everybody involved in the discussion. But because we couldn't use the clinics because they were closed, it wasn't possible to get everybody there. Now, the clinics have opened in the last few months at Acre Mills, and we are able to use one of those clinics. However, the COVID restrictions still mean that we can't have the number of people in the clinic that we would always have in the past. So there is a telephone discussion takes place first by the paediatrician, and then the carer and the children are invited into the clinic. So there's a mix going on at the moment. We just can't break the restrictions that the hospitals lay down. So that's good news that they're still 100% were done in timescales. The review health assessments, these are done by nurses in our looked after children's specialist team and the health visiting school nurses in the community. During COVID, we did have significant problems because we had to do them all virtually until about October. So we've been about nearly a year now back doing them almost all face to face, unless there's a COVID impact, which may delay the visit. But all assessments are done. They just might not be done in exact the right moment, but they're done within the month. Now, you can see from the data of the 12-month rolling data, that 88.2% of the under fives and 92.2% of the over fives were done in the timescales. The timescale means that if it was an older child and they have them done annually, if it was done on the 10th of June, for example, it has to be done by the 10th of June the year after. So those dates are pretty pernickety in the fact that it might fall on a weekend or a bank holiday, but that's what we have to stick to. For August, the average for both age groups has been about 76%. We had 11 breaches. That is quite a raised number of breaches compared to pre-COVID. But some of those reasons were to do with the COVID infections, an odd one or two to do with arranging with carers and the children. There was a bereavement in there. And some of that is to do with staff workload and capacity, not just for our team, but to do with other areas. Other local authorities are having the same problems where staff are having to be off because of COVID. In our team itself, our small team, that hasn't been the case, but we are in discussions with the Joint Commissioner to look at our current model of our team, to look at possible skill mix within that, and the specialist nurses role. And that's something that is ongoing to see how we can look at that, because our workload has increased and there is a few reasons for that. The dental is the other aspect that you look at. Registered with dentists, there's an average that we now know. We ask them at their review health assessment if they're registered with a dentist, and the average is 88% for all our children. For our over fives, it's actually up to 93%. So that's really good. I'll tell you a little bit more about the dentist in a moment. But the attended is what the local authority collects, and that's the figure that you've got in front of you, which is 50.7 attendance. We have to remember that this figure is gained from the review health assessment. So when we go and do that assessment, we ask them, have you been to the dentist? And that's generally where the information comes from. Sometimes social workers will tell us if on a visit that they know that actually the child's attended the dentist. Our figures for August are very similar for the younger children. It's coming out at 47%, that feels quite low, but 93% of our older children have attended. So there's a bit of a mix there, but you've got to be really careful with percentages, because that 47% is only related to 7 children. So that's got to be sort of taken into consideration. Something I want to bring up, and I mentioned here on the report, is the Flexible Commissioning Dental Project. This is very exciting and has been very successful as far as I'm concerned, and I think it's going to progress. This is a project for the Yorkshire and Humber. And what they've done is they've allocated a number of dentists in Yorkshire and Humber, and we've got about 7 dentists that have been allocated who have a remit for accepting vulnerable children, which is absolutely fabulous. And it works as well, because I've actually accessed 2 of these dentists' surgeries. It is only a project, and it's got to be assessed to see how well it's working. And we have only got 7 in Kirklees. But what that means is that particular dental surgery takes slightly less of the general population, and it is replaced by vulnerable children. So that might be children in child in need, child protection, or looked after children. And I'm in those discussions with these people to try and get the word out that we've now got this entry. And it does work. I'm meeting on the 5th of November with the Kirklees and Calderdale Oral Health Advisory Group. They know about this and they are wanting to promote this. It's gone to Locala. We do know that the Locala nurses are aware, but there's a few surgeries that I want to contact on this list to tell them who I am, because I realised that the two that I contacted didn't know how to contact me. So they'd contacted the local authority, but then got a bit lost in who do they talk to. So I'm on with that. So that's good news. One thing that you don't particularly ask about and not on here is immunisations, but it's a good news story. Immunisations are averaging 98% for under 5-year-olds and 92% in the over 5-year-olds, which is really good. That has been maintained pre-COVID, during the COVID restrictions and after. So that's really good news for our GP surgeries and immunisation teams in Kirklees, that they are getting our children immunised, which is really positive. The substance misuse, 5 young people are noted here, which has taken our score up, which is not the good sign, but I think this is quite realistic. 5 young people is what we usually have pre-COVID, and I think the fact that we've had quite low figures recently is probably just that we do rely on these young people admitting that they do have a significant problem, and I think now we're back face to face, we perhaps are picking that up a little bit better. All children, all young people who have any degree of substance misuse or thought to have are referred in. It's not just these 5 young people, so they are referred into our community substance misuse service called the BASE. And our annual report, it isn't on this report later on, but I think we've got an agreement that the annual health report for looked after children, it's now finished and it has been circulated to Elaine and the senior management team and Locala and the CCG. I think I'm going to bring probably to the next meeting in November and just give some key points and highlights from that for you.
Lovely.
Okay.
Thank you very much, Jill. Comments, questions, members? Colleen.
Yeah, I'd just like to say that all the dealings I've had with Jill and Locala have always been positive. She gets things done, gets it sorted straight away. I just wondered
ways of finding out. We don't just rely on the RHA, but that is the main way that we find out. But I will share that, Colleen, that dental thing.
If you want, are you wanting them when we do a thing to CC you in when the child's been, you personally, or is it a general email?
I'll send you that. We've got a general email, so it doesn't come to us just personally, because otherwise one person can get a bit inundated with things. So we do have a general email. The list of 6 dental surgeries, I'll tell you why I want to contact them first, Colleen, only because the 2 that I did contact were keen to contact me but didn't know who I was. And what I found was that as soon as they found out, the communication was on. But when I asked the receptionist in the dentist, they were a bit unsure about this flexible commissioning. So I needed to go to the practice manager to say, who is the person that's leading on this? So maybe I need to find out the names of the people who are leading on this first, and then let you have it. Because then if your foster carers ring up, they've got a name, or they know who they're going to if they actually got a knockback, which I hope they wouldn't. I'm hoping that, the word gets out. But yeah, so it's a job to do, but I don't know. We've got a very busy week this week and I just come back from leave. It's on my list of jobs to do, but I know that I'd got another priority this week. But it's to do, so I can contact these other practices. Yeah. So
it's like a mail goes out with saying, can you email this address when your child's been, with just the initials, because you'll be able to set who's who from what.
Yeah, or NHS numbers are good, K numbers are good. Yeah.
Yeah. And then we can do it direct to yourselves. I think carers just sometimes need reminding. And obviously, if we email it, I email mine into social worker when they've been, so social worker. So see you in on that as well then.
Yeah, so I need to send you the group email.
Yeah, that would be good.
Yeah.
Thank you.
I think that sounds excellent, Jill, and I know you've been in a campaign, a personal crusade of yours to get our children who are looked after into dentists, and
They're going
It's
to
an excellent step forward.
They're going to reassess it in about, I don't know, in the new year or something. And I've actually contacted the people who are in charge of it to say, hold your horses, maybe don't think you've got all the answers yet, because people don't know about you yet. I don't think the word's got around, and I don't want them to go, oh, well, it were all right, but, you know, it hadn't been that successful, because actually it'd be very successful if we all know about it. So I need to promote the other dentists in Locala, you know, the other ones that are listed. So a piece of work for me. It's just sat there. Need to get.
So you're going to make yourself known to those practices, and once you're very clear that everybody knows, you're going to let Colleen know, and she will disperse that across the fostering network.
I think that'd be really helpful.
Super.
They get inundated then, but I think they get commissioned for it, so they're keen.
Yeah, fine. Councillor John Lawson.
Thank you. Again, quite excited about the flexible commissioning. It seems a very, very useful way forward. Jill, you're probably all over this anyway, but I was going to ask how long it was going to last as a project, and you said it'd be reviewed in the new year. Funding being what it is and budgets being what they are, we often sometimes see these things go by the way, and I wonder whether that kind of evidence base that we could build now might be a way of the authority itself, Kirklees itself, doing that unilaterally if it falls by the way in Yorkshire and Humber.
I think it's going to probably show quite positive, John. I think, you know, because we've been asking for this for such a long time, and it's also linked to orthodontics as well, which is really good. You know, so this Yorkshire and Humber meeting that I go to, which is where I heard about this, they're really on it to do with dental services for vulnerable children. And there's so many more surgeries in Leeds and Wakefield and various that are on this. We've just been allocated like 6 or 7. I'm going to really promote this because I don't want this to go, and because I'm going to our meeting, like I said, on the 5th of November, you know, this the oral health advisory group, we'll be promoting it there, and that is our council, so I'm hoping that we promote it as well. And the more people that say it's working, we can't let it go. So fantastic.
I mean, that sounds like a real groundswell.
I hope so. And the orthodontics, if we refer children to the hospital, there's some talk about not particularly going to our orthodontic services within the community where you've got long waiting lists, which is no good for our children. For years and years, I've now had an inroad into Pinderfield's orthodontic NHS service, and I've sent loads of our children there, and they get seen really quickly. And they've been absolutely fabulous. But I think people have noticed that this is something that's needed. So I think this Yorkshire and Humber have done some work that says that looked after children should be referred into the hospital as part of the course and not going into the general population, which is unfair on the general population in a way because they also need seeing. But our children move placements, and you know, a 2-3 year waiting list is no good for our children.
In the end, Jill, we're corporate parents. We need to have pointy elbows for our children, you know.
We do. Don't worry, we do.
I like that, pointy elbows.
I've got pointy elbows.
I know, yeah. Any other comments or questions? Can I thank you for that really comprehensive report? Thank you, Jill.
Thank you.
The next part of this combined report is children looked after convictions. Is there anybody representing anything on that, or any comments to make?
Councillor Kendrick, I do apologise. There's no one representing the service this morning. Perhaps that's something we can pick up the next meeting. What I will say though, that over COVID aside, there has been a reduction in the number of young people receiving convictions through the court, but I think it's be worthy of a fuller report, and perhaps in November we could have the outcome of the Youth Justice Service inspection, because the report will have been published, so that can come hand in hand. So a fuller conversation about what's happening in that arena.
Yep, that's absolutely fine, and we'll look forward to that. I'm still pleased about the percentage of children who are looked after who successfully complete their interventions, it's still at a very high level, and I think, you know, that's something that we should be proud of as such. So next bit of the report is care leavers. Are there any things to highlight, or anybody got comments?
Yes, Councillor Kendrick, I'll just come in again. So just in terms of our care leavers and in terms of the data, what I'd like to put to the board is that I think we've got some work to do around understanding the definitions and how we define care leavers, and also looking at contacts and when we have contact with them, because the way that our current performance data is presented, it talks about seeing children, young people face to face, but we have a number of young people who have specifically asked that they don't want to be seen face to face. They're happy with a telephone call or an email. So I think I'd like to bring back a full report to the next corporate parenting board that absolutely sets out the work that we do, what our requirements are in relation to, or our legal requirements in terms of our care leavers, but also just setting out the work specifically that the personal advisors are undertaking. Because also I've had a look at the data around there's been a decline in the number of contacts. But when I've done a detailed review of the cases, and from the cases, the personal advisors have been in touch and in contact with the young people. And it's clearly recorded that young people are saying, you're being intrusive, I don't want you to see me, go away, I'm okay with my life. So I think we've got to respect that. So I think it'd be really helpful if the board agree that I do a detailed report setting that out. So and any specific questions that I'm happy to take today.
Okay. I think you're absolutely right. I think some clarity about the data that we get will give us a really true picture, and I think we would welcome that. Has anybody got any queries or questions about the care leavers data? No? Well, thank you for, Barry Lockwood. You need to undo your microphone.
Can you hear me now?
We can
I'm just
indeed.
looking at the pathway plan. Obviously, it's been a decrease. I'm just wondering whether that is a blip or what.
I've had a look at in terms of the pathway plans, and they have been some issues around timeliness of recording. So I've had conversations and they've been updated. So I've checked that, so I'm aware that they have been updated. And that within that, there are a percentage who, and again, it all fits into the specific criteria, who are saying, I don't want to see you. So therefore, we've got some pathway plans that are looking as though they've not been completed. So that's why I really want to go away and do a detailed analysis and get that understanding around how many young people of our care leavers are requesting to be seen, how many don't want to be seen by us, and what that looks like in terms of maintaining and keeping in touch. Because there are some young people who are clearly saying, I'm happy for you to keep in touch with me, but every 3 months, thank you very much. So it's that really. So I think it's really important that we do take account of our young people and respect their wishes and feelings. But I just want to assure you, the young people that do need to be seen are being seen by the personal advisors.
Yeah, it's just data that probably interesting is that people that don't want to see you, data I'd like to know myself.
Yeah, and I
think it'd be really useful.
Some value in really setting that out. So, and again, it gives a context to the work that we're doing.
Yeah, thank you.
Absolutely. Councillor John Lawson.
I put my hand up and then it was all said. Yes, just to support, just to support the work and say, yeah, we've mentioned it more than 2 or 3 times in meetings. So yeah, it's more than welcome, this work. So look forward to seeing the results. Thank you.
Yeah. Thank you very much. I'm just trying to switch a phone off that won't stop ringing at me, sorry. The next part of the report is adoption. We've had quite a lot about adoption today. I don't know if there are any comments or anything to highlight. No, and move on. And then fostering. Has anybody got any comments to do on the fostering part of the report?
Yes, Councillor Kendrick, I'll just give you a brief overview. Sarah Miles, Head of Service for Quality Assurance and Safeguarding. For those of you who aren't aware, I've just taken over responsibility of Head of Service Oversight for Fostering. I don't want to say too much about fostering, if that's okay, because I intend to bring an annual review of fostering report to the next corporate parenting board. And that will give me some opportunities to further look into the data in today's report. But what I would say is that we've got a net gain, a small net gain of in-house fostering households. And one of the things I want to delve into and bring back into the report in November is understanding of our fostering households gain, but also our resignations, and understand how we can better support our foster carers and improve our fostering offer. And I've already made links with the Kirklees fostering network, and I hope that we'll be able to work closely together over the forthcoming months to help me understand that. What I would say is that we're really important to learn from exit interviews. I'm also looking at improving our liquid logic pathways in terms of understanding our recruitment data as well, so that we can better understand who makes inquiries and how we approve our foster carers. So rather than go into too much detail today, I'd like to bring a full annual report to the next corporate parenting board, if that's agreeable with the board.
It certainly would be agreeable for you to bring something. At the moment, with the number of offers going on, I think the agenda for the next corporate parenting board is about 3 days long. So there may be a little bit of manoeuvring of some of these reports about, but it isn't that we don't think they're important.
Boringly, what it shows is that over 76% of our children and young people are in foster care, whether that's individual foster agencies or Kirklees fostering, which is above the national average. And also means that the number of children and young people in residential homes as placements is quite a lot below the national average. So on, I know we have got, issues and challenges in terms of recruitment moving forward, but actually when you look at our looked after population as a whole, it is a really promising picture in terms of placement with foster carers, really. So, but as Sarah said, I think what we want to do is bring the year's trends back next time so that we can explore with you as a board some of the really positive things that have happened throughout COVID, some of the positive practice that we want to build on, but B, look at some of our challenges with you as a board and take some feedback about how we can work together over the next year to improve on the challenges that we've got. So that's all I wanted to say, Councillor Kendrick. Thank you.
Thank you. Yeah, I'm sure there'll be plenty of challenges, but we'll we'll see. Colleen, you wanted to question or comment?
Yeah, just saying that for the last 3 years we have been talking about exit interviews for foster carers and learning why they're retiring or why they're being deregistered, or even the trend now where there's a lot of talk of people not wanting to foster anymore for Kirklees. So it's getting that in the bud and just finding out what the core issues have been. Sometimes it's lower management that are not responding quick enough and not being escalated up because it's stopped at a certain level. Luckily, we're meeting with higher board members of the KFN so we can actually address that. It's taking a while to get things sorted, but it is moving more positive. But yeah, exit interviews we've been asking for a long time so we can all learn and improve the service. So I'm glad to see that Elaine's including that into the report, and so is Tom. So yeah, thank you. Lovely,
thank you very much. Okay, I think unless there are any more questions or comments, that's the item on the performance data is completed. I'm sure if issues arise to board members and you want to send an email separately shortly. I'm sure people will be very happy to answer anything that you're not sure of. Could I move us therefore to item 10, please, which is, to my mind, a very joyous thing, is the staying put policy refresh. And, you know, I've had briefings of this and I think it's a piece of wonderful work. So, is it you, Elaine, that are
yes,
taking us through this?
Yeah, I'm going to talk through this. I'm going to give a more of an overview because actually some of the technical matters in this are more of an individual basis, but people have got sight of the report. And the report that have sight of is something that actually Councillor Kendrick kindly presented to Cabinet on the 27th of July, and it was well received and accepted, and we've commenced implementation since that point, although there's still some working out to be done. People will be aware that actually all local authorities are required to set out protocols and procedures for supporting care leavers aged 18 to remain living with former families up to the age of 21, and that's how you come to the terminology of staying put arrangements. And actually, the language act doesn't reflect really what it is. Is it, you know, I'm looking at Colleen because you're my line of sight, and Barry, you know, actually these are young people that are living with families that they know well, that have looked after them for a lot of years, and actually they are part of the family. It's just that we have these legal frameworks that we have to wrap around those situations, and they give it terminology like staying put. So I can only apologise for that because it doesn't really represent exactly what happens. The last policy was refreshed in 2016. I think our fostering network have been pleading for some time for a newer version. And I won't apologise actually for the length of time that this has taken, because it has taken some working out. We've done a lot of research. We've looked at all the best local authorities, those that are outstanding, to actually draw all the good quality piece of work to put in one policy, because actually our aspiration for our children and young people is that we achieve the best by them. So, you know, the support that wraps around them is absolutely important. So we've drawn on a lot of good positive things, and then put some Kirklees things in as well, just to add value. So it does set out an improved financial offer, which for us reflects the importance of actually young people remaining with their carers, and actually carers not being adversely affected by that, because that's with some of the comments that were coming back. Because if you look at the previous policy, children, young people remain, but actually then financially that impacted on carers, and we wanted to move away from that. We want to make this seamless so there isn't any adverse effect. And as I said earlier, Barry, this needs to be read alongside the care leavers support and financial policy, because actually young people in these arrangements can get support through the care leavers policy as well, making sure that they get all the support that they need. You know, there's a strong national evidence to support outcome of improving life chances for young people that actually remaining within their birth family or within families that has been their substitute family, if you like, so where they've lived with foster carers for a long time. Helping them maintain living there just improves their opportunities going forward, and that impacts positively on education, training and overall life chances, how they develop their confidence and resilience as well, so that actually they are more ready to go out into that you know, adult world. You know, young people leaving earlier than that, some actually, because we're all individuals, aren't they? Some will fare really well, but others won't do so well. So this is a real opportunity to wrap around actually 18-year-olds that think they are this grown-up adult, but then in real terms it's not always the case, is it? So we have to make sure, work with them actually from an early point, to start having conversations much earlier. Ophelia's nodding, because this is something we're working on as well, having those conversations early so everybody's prepared, everybody understands what's expected and what will be offered. It's really important. So by the time 17.5 comes, actually we know what's going to happen post 18. And Ophelia talked about the service director looking into things. I'm checking on plans and decision making all the time to make sure that they are timely and they're in the best interest of the young people. So the refreshed policy, which is improved, will see the introduction of some changes and some aspects which will feel different for both carers and for young people, and a lot of that is about that change from being a foster carer to the situation you're moving into these arrangements. And when I said I won't go into the technicalities of that, because it will be different for different carers in different circumstances, so we want to sort of have those conversations very early on, make sure that they get the right advice around what that transition will be, because you're going from being a foster carer to, you have to have like a legal agreement in place. And I've seen already for some carers that this feels quite alien, but actually if we get that right and make that a smooth transition, and I think we have the conversation about the understanding of why that's the case, it will make carers feel better about what's happening moving forward. So I'm not going to go into the details of the weekly allowances because they're there and set out for individuals. I think, one of the things that's important is the responsibility of the young person for rent. It's a small amount, but that begins the process of what they will move to going forward and the new arrangement that they're in. I think I've talked about early planning. Allowances for staying put carers when young people are at university, we've built that in. We've built that into the care leavers policy as well, to make sure that actually, again, we're offering the right support both practically and financially. And that staying put carers are financially not worse off. That is really key. And actually it does have I talked to you about possible influence and our sufficiency of foster carers, but it can actually free placements up as well. I think what I would say about this policy alongside, and I know, Colleen, I'm looking at you in particular because you've said this to me many times, this has been a long time coming. It's arrived, it's at a young person near you. This is part of our aspirations, not only for our young people, but actually what we want to do for our fostering network, for our foster carers that are so valuable, to our young people, that they're able to make that longer term commitment and they're not having to make decisions because actually going down a route means that they're going to be adversely affected. It's about our aspirations for having the best for all our children and young people that are not able to remain within their birth families. The next best thing is the fantastic foster carers that are available to them and giving them that life support. Because I know beyond children moving on, the carers are still there as their family members because that's how they're seen. So that's just a real overview of this policy. I know, Colleen, you're already checking into it because you've got a young person that's going off to university. So any questions really? But some of the technical questions, I will say, will be individual to different carers as well. So you can't do that overarching, this is a decision for all. Because it is that work we do with individuals to make sure it's right for them and right for their young person.
Colleen and then Councillor Lawson.
Yeah, it's been a long time coming. I can honestly say it's one of the best policies I've ever seen for staying put. There are a couple of things which I think we could, as initial launch, I think we should get the tax office people in with existing foster carers that are already doing staying put and anyone that's potential in the next 6 months, have a massive kind of meeting how it will affect you financially, tax purpose wise, because obviously that's one of the things that's an issue. Obviously, you said you recompense people if it affects the benefits, but obviously we all need to, that's the worrying part for people. I think that was it a bit, yeah, sometimes the wording from PAs isn't always, sometimes the wording from PAs to foster carers and looked after children, it's not early enough.
Yeah.
Can be deemed as they're now your landlady or landlord, and that's what the policy is. It's a continuation of a family, and that needs to be said. It's a family, supporting that child. We're not landladies or landlords, because I'll tell you now, I'm in contact with 5 of my previous children, and even one came last night for a quick supper because he was in the area, and I'm taking one to doctors tomorrow, and she's 23. So we are constantly doing staying put, whether we're paid for it or not. But it needs to be said, we are family. We are not landlord and landlady, and that's what we need to get across to PAs. PAs need to talk to the foster carers first. I know they're there for the child, but it's a family approach.
And absolutely,
sensitively, because it can
picked some of that up already, Colleen, and we have got an action plan. Ophelia's working on that, and Ophelia's working closely with the PAs, because actually what we've got to do is re-educate some of our PAs as well, moving away from that rule book approach that they might have taken in the past, giving them freedoms to make some decisions as well. But you're right, the language is really important. So Ophelia's got an action plan, and she's already had some sessions. And you're right, when we do a bit more of a formal launch, we're aware of the tax issues where people can get advice. So as I said, this is a transition, but you know, we're taking all that into account. The language is absolutely the right thing, and I take that.
Yeah, and also when it officially gets put in place and payments go ahead, is there any scope for backdating for anyone that's not been they've been hanging on for it, but they've gone for it anyway, but obviously they're on different scale? Would it because if it was supposed to be in April, would it get backdated to April because there's been delays? I don't know.
No, it can only go from the date it went to Cabinet, which is the 27th of July, because that's when it's formally agreed. Right. I've checked that out as well.
Okay, that'll help with some carers, obviously, that their children have gone 18 since the 1st of September, when they've gone to school, you know, to college and things like that. That will really help them, so that they're not disadvantaged from that.
Absolutely.
Yeah.
I've got 3 years worth of back pay though, but it doesn't matter. Worth every penny of it. Worth every penny of it. Don't worry.
Yeah. I'm just relieved it's here, and I do think it's a great step forward.
It is, and we're trumping a lot of other local authorities with this one. So thank you for the hard work being put in this last long waited, but definitely worth the wait. Thank you.
Thank you.
Yeah. John.
Thank you. Yes, they're very welcome update and refresh. It may have taken time, but I take Elaine's point right. We want to get it as right as we can, and that's always worth taking that bit of extra time and care over. Going forward, I notice on 5.3 of the report we talk about regular updates on progress and the impact/outcomes as a result of the implementing the policy will be scheduled in the forward plan and provided to corporate parenting board, and that's welcome.
Mm-hmm.
Because we need to measure success. Is it working? Is it panning out for the people receiving it, and is it getting through properly? So that's one side of it. The other side is, having done all this huge amount of work, how do we keep the plate spinning? So when we've refreshed now, when do we review the document next? And that's that's a genuine question. Do we keep the plate spinning by doing an ad hoc review when funding might change, or do we make it a regular review? So these are kind of open questions that we perhaps should be mulling over now.
I think, Councillor Lawson, it's really very interesting, because already, and one of the things that Cabinet did was delegate responsibility to myself as Service Director to make amends to the document, and already through conversations that we've had along with the care leavers policy, we're looking, are any changes required, because we want to be responsive. So we don't always want to wait for a formal review, which I think probably in 6 months we'll want to formally review this, how it's working in practice. But because I've got delegated responsibility, what we would do is have a conversation. If we feel there's some changes, I can do that in consultation with Councillor Kendrick as lead member in the first instance, and then bring that back to the corporate parenting board, so we can inform the board of any changes that have been made or are being proposed. But having then formal 6 months.
I'm glad that those arrangements. I'm a fan of delegated responsibility in these situations. So yeah, I'm very glad about that arrangement. Thank you.
Thank you.
Excellent. I do think you've opened the door, though. You know, our colleagues here from Kirklees Fostering Network will not be slow at telling us what we need to adjust and nudge and get right. But actually, you and I both welcome that. I know that, Elaine. So any other comments or questions on the report? Can I just say, I've never been a foster carer, but one would think having this staying put policy might actually attract would-be fosterers to Kirklees, because I think if I had been a foster carer, I'd have been wanting to see it as a long-term thing with a particular child or young person, for me personally, and knowing that there's a really strong staying put policy must be an attractive piece of support to would-be foster carers. Yeah. And I think we ought to promote that loud and clear. But thank you very much for all the work that everybody who's been involved in this, Elaine. You know, I'm a huge enthusiast. I think it's absolutely splendid. Okay, so item 11 is a virtual school governing body update. And Janet, I hope you're able to enlighten us a little bit. Just something brief will be great.
Hi, good morning again. Well, it will be brief, Councillor Kendrick, because as you'll be aware, this is a standing agenda item, and there hasn't been a governing body meeting since we last did this at the Corporate Parenting Board. The governing body meetings are half-termly, and the next one is due on the 21st of October this half-term. So it's very brief. Thank you.
Yeah. So we look forward to the next time we meet, and there will be something then concrete to report. So we're doing quite well here. So item 12 is an ambition board update, and it's got both Elaine and Tom's names underneath it. Take your pick.
Thanks, Councillor Kendrick. Yeah, I don't think there's probably a great deal to report from the last ambition board, because I think it was due last week and it didn't take place for a number of reasons. So I guess it's just to say we continue to widen out from it being the improvement board to take a wider view. So I think on the agenda on the next time we'll be looking at the SEND transformation plan that we've got, you know, our system-wide SEND transformation. We continue to look at performance and areas for improvement, and also we continue to monitor the work from the Children's Social Care 10-point improvement plan. I'd say on the whole, Elaine, it's still very well attended. I would think, and I think, and everyone else is still very committed to that improvement journey. It's just, you know, that widening out to take the wider system view in and early support and other aspects. I don't know if you've got anything to add, Elaine.
No, I think you're absolutely right, Tom, and it's interesting because we're just reviewing what was our improvement plan as a children's social work service, and actually thinking about our ambition plan in terms of, because we've moved to a next phase, and it's our ambition for our services to be outstanding like all children's services. I think we have got good partnership arrangements. I think we do have good attendance. I think the meeting, the ambition board meeting, will be at its best when partners are also presenting reports and data around, you know, the work that complements the aspects of work that we're doing.
I think that's a really valid comment, Elaine. You're absolutely right. I do think the sort of hybrid nature of the ambition board have really helped with attendance. You know, colleagues in other partnership organisations like health, you know, not having to charge halfway across Kirklees to get to a meeting, but being able to still be present and contribute has really made it useful. But I do think it is time for some of our other partners to be coming and filling in some of the blanks that we have around some of the issues. Good, okay. So item 13 is updates from board members on interactions with services. I don't know if anybody has anything that they wish to report. I'm not seeing anybody. Well, I'll have a go then. Andrew Marchington is here, and he and I have met along with Councillor Pattison to talk about scrutiny and you know, scrutiny's programme, and also dividing up the work so we don't duplicate items of work. And I know scrutiny panel members have had some interaction with services as such. and I'll finish my bit, and then I'll bring in a couple of other people who've got their hands up as well. I went to the Yorkshire and Humber lead member Children's Services lead member network on the 2nd of July, and I am now the chair of that lead member network for Yorkshire and Humber. Councillor Patterson and I had a meeting with Stephen Cullen in August, who's the independent chair scrutineer of Kirklees Safeguarding Children's Partnership. I went to the Kirklees Food Network, I think it was last week, simply because of the way it impacts on some of our families who are under greater financial strain. I'm really interested in what's happening there. And yesterday, I had a really interesting webinar on contextual safeguarding, which made me write down a lot of notes, and you'll be pleased to hear, colleagues, I have a lot of questions I want to ask in the future, but not for this meeting. I'll catch that up at portfolio briefings. Colleen was very quick to put a hand up, but I'd already started gabbing on, so Colleen.
I've been involved with Children Care Council. They've been running a safety music project, I think, and I just like to say what fantastic job the safety music team are doing, and what fantastic video, audio, and the kids' participation has been. And I wish we could just expand that out to do more with that, because it's made my young person change career and actually go to university. Wow. The music production. It's been that influential on her. So, it's a fantastic tool, absolutely fantastic. And I'd love to see more of it. I really would.
Perhaps that's something that our folks who are working on the places to go, things to do, could look at that as a potential to see what could be done more on that. Yeah. Thank you for that, Colleen. Andrew.
Yeah, thanks. Yeah, we've Children's Scrutiny have got a programme of visits in place to go and have a look at frontline working to corroborate some of the information we get back at Children's Scrutiny panel. So Dale and I last week went down to visit the Valleys Cluster Children's Social Work team. So we met frontline workers, team managers, and the cluster manager as well, and it was a really positive meeting. It was great spending that time with them. A couple of highlights. It was a really long report. We're going back to next Children's Group, but some of the highlights about casework management, and given where we were, looking at the improvement journey, how caseloads are much slower than they were. We've got a fully staffed team. Frontline staff were feeling about very positive for how the casework was managed in terms of their workloads, but also their professional development. So they were getting interesting cases, that were looking to develop them. So that was really positive. I think the other highlight was about children's voice. I know Dale has always been really keen about the importance of getting children's voice. Perhaps historically, that's felt a bit like a tick box exercise. It's on the form. What we heard of is an example of a team that was really enthusiastic about children's voice, recognising the importance of that, and we heard details about how, in one case in particular, that had been really important in getting the right decision for children, young people, and families. So that was really productive from our point of view, and it was so positive that we would like to go and visit one of the other teams as well, and I'm sure that we're doing. I think as we get, the other visits are coming in. We're quite happy to report back to Corporate Parenting Board about how that's working. Oh, and there was an opportunity for partnership. There was a member of the adult mental health team there at the Valleys Cluster, providing support to children's social workers where that was, so part of the wider family support. Is there anything, any advice that they need about making sure the best outcomes for the children in terms of adult mental health? And they were really positive about how their professional advice was being listened to. So the children's social work team said it was valuable to have them there, but also they were positive about the interaction and their opportunity to contribute at that stage. Thank you.
Lovely. Really good to hear. Thank you for that, Andrew. Colleen, you want to come back again?
Yeah, it was something that was brought up yesterday by our Facebook group regarding the children's celebration, you know, that's coming up soon, on 14th. I remember in the past that foster carers were asked if they could put forward. I haven't seen anything of that this year. It just seems to be more social workers and children's social workers, because we weren't even aware that it was going on as a KFN. So it just seems like maybe there's a missing link there this year. I don't know.
Hi, Colin. We can pick that up. I think we had the planning, the people doing the planning came to our SLT. I think it was a couple of weeks ago, and I wasn't aware that you'd not been involved. So I can pick that up.
Yeah, that would be good if you could for next time anyway. If that's okay.
And
yeah.
you know, it's
a fantastic event, and you know we should celebrate all the achievements the kids have done, not just academically, but you know, socially as well, you know.
Exactly.
And foster carers are all behind celebrating things, you know, especially when it's a free meal. But I'm not going to say that out loud. But yeah. But yeah, it's celebrating the work that the kids are doing and the foster carers are doing to help support that, and the team around the child as well, which is amazing. So yeah. Great stuff.
I think that's really important. Yeah. Barry.
Yeah, I've been to a few KFM meetings and I've had a few issues raised. I just wonder whether this committee can help us with any of them. And it was raised that foster carers are not getting email addresses.
Barry, sorry to interrupt. I think probably if there's any, you know, we have the regular KFM meeting, don't we? Me and Colleen and Keith meet regularly, and Sarah.
Well, I think it needs to be sorted out as well here as well.
I'm not saying I'm not saying it doesn't need to be sorted out, Barry, but I think probably if there's anything to do with email addresses or kind of operational issues, if you just come to me direct as service director, me and Elaine can see that. I'm happy to hear what the issues are, Barry, but I think, you know, maybe isn't the most appropriate forum.
Right, fine. Nothing more then.
All right, thank you very much. Can we move on to the agenda plan? I mean, we've had more offers than hot dinners today, but you know, that's always welcome.
Councillor Kendrick Dale's got a hand up. I don't know whether you can see Dale.
No, I can't actually, but
no,
Dale.
I could see Dale had got her hand up.
Yeah, I did have. Thank you very much. I just wanted to add something to what Andrew said, and that was the overwhelming enthusiasm for the cluster system. From the head of the service all the way through, they were all definitely very enthusiastic that they had this particular system in operation.
Excellent. That's good to hear. Thank you for that, Dale. Thank you. So, agenda plan. I don't know if anybody has any comments. On page 51 is the November plan, and 52 is the January plan as such. I think we may have to, in the light of some of the things that have arisen today, we may have to manipulate that a little bit. I think it's, for me now at this point in time, it's a little too complex.
Councillor Kendrick, can I suggest when we actually meet with yourself and Jodie, we look at the reports that are being proposed and set them out in an order that means they've got adequate time on each meeting?
I think that would be really helpful. Yeah. Yeah.
Thank you.
If there's anything anybody feels that we're not addressing, you know, if you let us know, and we will look to see where we can incorporate it. Ladies and gentlemen, thank you very much for your attendance. Thank you everybody for your contribution, for the presentations, for the questions and comments. I think we have come to the end of this meeting, so I now intend to close the meeting. Thank you very much again.
Thanks, everyone.
Thank you.
Thank you.